In the Sagittal Hip Disassociation Strength Series, Level 3, you're now going to be doing exactly what you did in Level 2, except you're going to be using a weight. So let's run through the form really quickly, because by now you really know what it is, and you don't want to hear me talk forever about things you already know. Foot is straight, no excessive pronation, supination, and really very little, if at all, any pronation, supination. Just keep that foot with a good arch. Patella tendon in line with the second and third toe. Acetabulum, the best alignment you possibly can with the patella tendon. As you know by now, there's going to be a little bit of medial angle there, but you minimize it as much as you possibly can. What you do not want to do is that. Awesome. Keep the pelvis perfectly neutral. So we're going to keep that pelvis neutral, no excessive anterior, posterior pelvic tilting. Thoracic spine extended, middle of the ear in line with the middle of the shoulder. The motion, just like Level 2, will look like this. The hand is, go ahead and pause for me on the bottom. The hand is going to be reaching towards the little toe, not with compensation, but just to the point of end range. And then you're going to go into end range shoulder flexion and then come all the way back up. Awesome, let's go ahead and turn around and look at a posterior view aspect. So we're going to be standing on this right support side. Notice that the pelvis is perfectly aligned here, level, even when he, yep, perfect, not retro Trendelenburging or Trendelenburging. When he bends over, goes into hip flexion, he's still going to keep the pelvis level from this horizontal aspect here. And we're not going to go Trendelenburg or retro Trendelenburg. And also, let me point out one more factor here that's kind of important. He's not going to be veering to the right or left. Let's come all the way back up. So when you start, so this knee is always at 20-degree bend. This knee can start near an extended position, but when you go up, it is totally okay to flex that knee anywhere up to 90 degrees. It does not need, this floating leg does not need to stay straight. Once you reach towards the little toe, let's do that again. Once you reach towards the little toe, arm goes into flexion, then you come all the way up. By adding this weight in arm and flexion here, you're going to be adding additional load to the glutes, the hips, the hamstring, and especially if you're as tall as Matt is, there's a lot of leverage from way out here all the way to this activating muscle, these primary activating muscles, so it adds a lot more load, plus you're getting some cross-diagonal core stability within the thoracic rotators and the spinal stabilizers, so that is awesome work here in Level 3.